The main purpose of this academic article is essentially a systematic review that examines the association between adhering to established cancer prevention guidelines for diet and physical activity and overall cancer incidence and mortality. In essence, a systematic review in the form of an academic journal or article is aimed to identify, evaluate, and summarize findings that are strongly and relevantly associated to a specified study or issue. In a simpler explanation, this systematic review looks to investigate if adhering to dietary and exercise guidelines can help promote and enhance the obstruction of cancer formation and cancer related mortality. The systematic review by Kohler and other authors collected relevant studies and articles from system databases such as PubMed, Google Scholar, and Cochrane Reviews, which allowed for the accumulation of their respected and reliable sources in connection to their specified topic. During the collection of such studies, efforts to meet specified criteria were administered for each study collected. The criteria included data collected from participants and aspects of their physical activity and diet, presented and calculated adherence score that was based on the structure of American Cancer Society and the World Cancer Research Fund, and it also had to present results that reported cancer outcomes of incidence and or mortality. Out of a total of 2,033 selected relevant and reviewed studies, only 12 met the specified criteria as listed prior and were utilized in the systematic review's findings. In a basic explanation, the systematic review article's investigation on cancer prevention and health promotion guidelines primarily focused on specific lifestyle recommendations, which included 1. Achieving and maintaining a healthy weight, 2. Adopting a physically active lifestyle, 3. Consumption of healthy diet, which mainly focused on plant-based foods such as fruits and vegetables, and 4. Limited alcohol consumption. Based on these guidelines, a score is then formulated based on the adherence of such guidelines and would help identify if there is any correlation between complying with the aforementioned guidelines and the occurrence of cancer development and growth. The scoring system was recorded as followed. If the patient or individual did not meet the lifestyle recommended guideline, then their score would reflect a tally of 0. If the patient or individual partially met the lifestyle recommended guideline, then their score would reflect a tally of 1. If the patient or individual abided by the lifestyle recommended guideline, then their score would reflect a tally of 2. The scoring system, as mentioned prior, formulates a total scoring range of 0 to 8. 0 asserts the individual did not adhere to the suggested guidelines, and a score of 8 asserts that the individual perfectly adhered to the recommended guidelines suggested by ACS and WCRF. For reference, individuals who score a 7 to 8 are referred to as having high adherence to the 4 aforementioned guidelines, while individuals with a score of 0 to 2 are referenced to have a low adherence to the 4 aforementioned guidelines. In regards to the statistical findings of the systematic review, it is apparent that there was a strong correlation between cancer mortality and incidence with that of a participant's diet and or physical activity. For the sake of simpler analysis and discussive purposes, I will present findings from 4 of the 12 distinct articles that propose statistical significance in relation to the topic at hand. So to begin, Article 1 or Study 1, titled Cancer Prevention Study 2, reported a 24% to 30% reduction in cancer mortality over 14 years of follow-up for both men and women when the participants expressed high adherence to the ACS guidelines when compared to individuals that had low adherence to the recommended guidelines. For article number 2 or study number 2, also titled American Association of Retired Persons Diet and Healthy Study, or NIH-AARP, this specific study reported a statistical significant decrease in cancer incidence over a 10.5 year period for highly adherent men and women. Additionally speaking, over a 12.6 year time frame, the same study reported a significant finding that showed if men or women adhered highly to the recommended guidelines, they would reduce their probability of encountering cancer mortality in their lifetime. For study or 3 or article number 3, titled European Prospective Investigation into Cancer and Nutrition, this particular study, similar to that of study number 2, showed statistical significance that showed a reduction in cancer incidence over a 11-year follow-up for both highly adherent men and women. Lastly, Article 4 or Study 4, titled Vitamins and Lifestyle, or VITAL, ultimately was cancer specific and expressed that there was a consistent reduction in breast cancer incidence when the participated women highly adhered to the guidelines suggested by American Cancer Society. Furthermore, meeting all 4 recommendations, as we've seen prior, reduced breast cancer incidence by 60% when directly compared to the women that did not adhere to the lifestyle recommendations. So, based on the 4 articles and studied, as I mentioned previously, the systematic review was able to conclude that adhering to ACS, or the American Cancer Society's lifestyle recommendations, would ultimately reduce the incidence of cancer or the mortality rate of cancer in individuals that highly adhered to the guidelines presented by ACS. As for the research design of the systematic review, it is apparent that it can be classified under 2 categorizations. First would be a descriptive design, which relies on observation as a means of collecting data and attempts to examine situations in order to establish what is the norm and what can be predicted to happen again under the same circumstance. This can be seen and identified in the discussion and results section of the systematic review, allowing for it to be conformed to such classification. Secondly, it can also be categorized or classified under experimental research design, which controls relevant conditions and investigates and observes the effects of the manipulated conditions and/or variables at hand. Now, the systematic review in and of itself is not an experimental design, but the 12 studies utilized and reviewed and incorporated into the statistical findings of the systematic review ultimately conform to an experimental research design, allowing for its partial categorization and classification into such category. Statistics seen in the systematic review utilize what is known as descriptive statistics or summary statistics and is labeled as such because the authors of the review only describe the visible characteristics of the dataset and do not present any inferences or generalizations based on the study's sampled data. Ultimately, this method, known as descriptive statistics, simplifies the relevantly significant findings that allow the audience to clearly understand and comprehend the presented data. It ultimately gives us, as the audience, a manageable and meaningful summary of the underlying phenomenon present within the systematic statistics. In terms of the form of data, the form of the numerical research can be classified as quantitative and is classified as such because all studies, findings, and conclusions are based on numbers which are analyzed through the technique of statistics. Additionally, to an extent, the systematic review also highlights as secondary data and interprets primary data from related and interrelated sources. Although secondary in its analysis, I would not address the finding as unreliable because the research of the systematic review does not skew the data, but presents the data in a simpler perspective for external audience interpretation and comprehension.
When examining the systematic review's acquisition of knowledge, it is apparent that the authors utilize a sense of deduction or deductive reasoning to highlight their significant and relevant findings. Because it is referenced or identified that the authors incorporate deductive reasoning, it must be apparent that such assertion comes parallel to the suggestion of a premise or premises. However, the authors do not directly affirm their premise, but present their findings in a manner that is backed by several relevant studies that are validated through statistical findings. Based on such explanation, the systematic's primary premise suggests that if individuals, both male or female, were to adhere to the guidelines specified by American Cancer Society, then such assertion would lower the probability or likelihood of them encountering an incident of cancer in their lifetime or from cancer related mortality. Therefore, as I will explain further, these premises particularly present themselves in a form of propositions, which is the main structural component of the article's entirety. The structure of the systematic review is based, as mentioned prior, around conclusive propositions that are validated through statistical findings experimented by other outside sources and authors. In a simple explanation, the utilization of proposition allows the study to concentrate on the particular relationships between events or circumstances. As for the highlighted proposition in the systematic review, it is apparent that the study's research indicates a strong deduction of the interrelationship between the adherence to diet and exercise guidelines with that of eventual cancer diagnosis.